Namaskar. Today we'll study skin disorders. So skin is basically an organ and it is coming under integumentary system. We can call it as integumentary system. And in addition to skin, the other organs will include the hair, nails, glands, nerve endings. And skin, we call it as an organ because it consists of different tissues. The epithelial tissue, the connective tissue, they are joined to perform specific activities. And this skin has three layers. It is the outer protective layer. It protects our body. The deepest organs of our body is protected by the skin, and skin has three layers: epidermis, dermis, and hypodermis or subcutaneous layer. And epidermis consists of stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basal. And this stratum corneum is the dead one. This is the outermost part of the epidermis, and it prevents water loss from the body. It also denies the noxious agents in the environment coming in contact with deeper layers of the skin. Then the dermis is consisting of the outer papillary layer and the inner reticular layer, and it is highly vascular. Blood vessels are there, and it is made up of fibroblasts and collagen fibers, macrophages, and the sweat glands, and the sebaceous or oil glands. And it is also richly supplied with the nerves, and this is why it is the metabolically active part. Metabolically active part is the dermis. Then below the dermis we have the hypodermis. It consists of areolar and adipose tissue, and it attaches to the underlying tissues and organs. So this hypodermis provides the physical and thermal protection to deeper structures of the body. So this is all about the skin. And when we say the skin disorders, they basically affect the epidermis. Very rarely they affect the dermis. And so epidermis is affected, and the epidermal factors, which include your hair, the glands like sebaceous gland, pseudoreferous glands, these are affected, and there will be different disorders. So first, the epidermis. The epidermis consists of four principal types of cells: keratinocytes, melanocytes, Langerhans cells, and Merkel cell. The keratinocytes are the major cells. Almost 90% of the total cells of epidermis are keratinocytes, and these keratinocytes, they produce the protein keratin. And this keratin is the key material of hair, nail, and outer layer of skin. Okay, and when there will be a proliferation of keratinocytes and there will be more deposition of keratin, that will cause hyperkeratosis. And there are many disorders in which there is hyperkeratosis, like psoriasis, acne, corns, warts, dermatitis, the fungal infections like ringworm infection. In all these cases, there is hyperkeratosis, and we can use keratolytic agents. The second one is the melanocytes. Melanocytes produce the skin pigment, the brown-black pigment called melanin, which provides the skin color. And so there can be two types of problem, like hyperpigmentation if there is increased production of melanin, and there can be hypopigmentation. So hyperpigmentation mostly in dark skinned people that is prominent, and we can use demelanizing agents in those patients, and hypopigmentation like vitiligo. In these patients there will be partial or complete loss of melanocytes from the patches of skin, and there will be production of irregular white spots or patches on the skin, and this is not that a problem with many symptoms. Mainly the appearance of the person will look something which is the person will not like, and in these cases we can use melanizing agents. So these are the drugs acting on melanocytes. Then there is a problem called albinism in some people. This is a hereditary disorder, and there is inherited inability to produce melanin. So melanin will be absent in hair, size, and skin, and those persons will be called as the condition is called as albinism. Then the third cell present in epidermis is the Langerhans cells, a type of dendritic cell, and this is also called antigen presenting cell. So it has a role in our immune system, and these cells interact with helper T cells in immune responses and are easily damaged by UV radiation, and they arise from the bone marrow and migrate to the epidermis. So there can be some immune disorders and autoimmune disorders like vitiligo, psoriasis. These two are also autoimmune disorders. That means the immune system is activated against our own body. And there can be allergic skin disorders like urticaria, atopic dermatitis, allergic contact dermatitis, eczema. So these are some of the immune disorders. Then finally we have the Merkel cell. These are located in the deepest layers of the epidermis of hairless skin. Mainly these are present in the hairless skin, where they are attached to the keratinocytes by means of desmosomes, and their function is sensation of touch. Okay, so this is all about epidermis and the disorders associated with it. Then we will discuss the epidermal derivatives. The epidermal derivatives can be divided into hair, glands, and nail. And hair, there can be excessive hairness or there can be loss of hair. So accordingly, two conditions are there: hirsutism and alopecia. So excessive hairness in female and prepubertal male is called hirsutism, and we can use the female sex hormone like your progesterone derivatives. We can use here. Progesterone derivatives like cyproterone we can use. Then alopecia is loss of hair in any region of the body, and this alopecia can be of three types: androgenic, and it is mostly in women, and the excess androgen, that is testosterone, and its active metabolite dihydrotestosterone is increased, and that can cause alopecia. And the other is androgenetic. It is hereditary, and in these cases again due to excess activation of dihydrotestosterone, there will be loss of hair, and it is called also male pattern baldness, and it can occur both in men as well as women. And the third one is the alopecia areata, which is an autoimmune disorder. So in these cases we can use trichogenic agents, which are basically maybe your vasodilators like minoxidil, which is an antihypertensive and potassium channel opener vasodilator, and it can increase the blood flow and protect the hair, or we can inhibit the conversion of testosterone to dihydrotestosterone by using the 5-alpha reductase inhibitors, and these are the trichogenic agents like finasteride, dutasteride. We can use them. Then we have the glands in skin. We have two types of glands: sebaceous glands and sudoriferous glands. Sebaceous glands are also called oil gland, and sudoriferous glands are also called sweat gland. So sebaceous glands produce sebum, and when there is increased production of sebum, that will cause two types of disorders. One is your seborrheic dermatitis, and the second is acne. And seborrheic dermatitis, the inflammation of dermis or skin, and here it occurs in those areas which are rich in sebaceous glands like scalp, face, trunk, and in these cases we can use the anti-seborrheic agents. Then acne, there is a sebaceous gland inflammation and increased production of sebum, and it can be of three types. It can blackhead, whitehead, or deeper boil-like lesions like nodules or cysts. This is the common one, and there can be blackheads or whiteheads, and basically there is because of increased production of sebum, this acne results, and there will be bacterial infections also. So in acne we can use antibacterials and the retinoids or vitamin A derivatives for treatment of acne. Then the sudoriferous glands, they produce sweat, and in some individuals there is increase in sweat production, and this condition is called hyperhidrosis, and to decrease the sweat we can use anhidrotics. And increase in sweat production causes bacterial growth, and that bacterial growth produces undesirable body odor. To mask this body odor we can use deodorants. And then finally we have the nails, and nails are prone to your fungal infection. The condition is called onychomycosis, and we can use antifungal agents like griseofulvin, terbinafine, itraconazole. All these drugs can be used in case of nail infections. Then we have finally we have the skin damage, because of its location the skin is prone to damage by trauma or injury, sunlight, microbes, and ectoparasites. And sunlight, mainly the UV rays in sunlight can cause sunburn, and on chronic exposure it can lead to skin cancer. So we can use sunscreen agents to prevent the sunburn. And then the microbes can be your bacterial infection, fungus infection, or viral infection, and that bacterial colonization occurs in wounds, burns, surgical incisions, eczema, scabies, in acne, as we have discussed before. Then there can be conditions like impetigo, which is characterized by the formation of pustule due to bacterial infection. There can be furuncle or boils, and it is due to staphylococci infection, and impetigo is due to your staphylococci or streptococci infection. So we can use antibacterial drugs. Then fungus like candida can cause candidiasis, ringworm or tinea infection can cause dermatophytosis. Then it can also cause dandruff and seborrheic dermatitis. So increase in sebum production associated with pityrosporal yeast infection can cause dandruff and seborrheic dermatitis. Then virus like papilloma virus can cause wart. Then herpes like herpes simplex can cause cold sore. And then herpes zoster or varicella zoster can cause chicken pox. And measles, measles is another problem. And we have vaccines against measles, of course. So this is also a viral infection. Then the ectoparasites which live on outside the body surface on the skin, and they include each mite, lice, etc. And each mite like Sarcoptes scabi causes scabies, and lice like Pediculus humanus can affect our scalp, and it can cause pediculosis. And the drugs used are pediculicides, and for scabies we can use scabicides. So all together they are called ectoparasiticides. So these are all about the skin and the skin disorders and the drugs which can be used against the skin disorders. Thank you.